all three of them. I'm not gonna go through the whole spiel with all three of them. Y'all have an IV start kit. I don't have one, but everything I need is up here. It's just in a different wrapper. You need a dressing. You need tape. I'm not gonna do this right now. You need a saline lock. Some of us, you may hear us say a hep lock because you used to flush things with heparin, but we're talking about a saline lock or an INT, which means intermittent device. You'll see some that have tubing with it and some that are just a cap. They work the same way. Both of them there so you can see them. You gotta have a tourniquet that comes in your kit. There's an alcohol pad that comes in your kit. You're also gonna have to have a flush. Now you heard me say that we used to call them hep locks. This is a heparin flush. It's yellow. Some of them are blue. The white ones are usually saline. You shouldn't have access to this, but if you happen to see a flush laying around and it's a different color, look at it. It's probably heparin.
Why did they flush with nothing to keep it in the pot?
Yeah, keep it from the pot. All right. Let me see what else. Okay. When you get ready to start your IV, these are the ones I believe that you have in your kits. Okay, so I'll show you this first. Okay, so you want to open this, and you want to keep everything. It's not a sterile procedure, but it's kind of like syringes and needles when you're putting things on the end of, like when you're connecting the needle to the syringe. You want to make sure nothing touches the end of the needle and nothing touches the end of the syringe. You want to keep the end sterile. I'll show y'all this one first.
Okay. And then I would fill it. And if you'll look at this. Alright. Alright, you see right here.
You want to go ahead and prime your saline lock, or your cap, just your cap. When you're getting ready to get this air bubble out of here, you want to pull the syringe back first and then push up. If you just push it up, it's going to shoot and hit the ceiling, or your instructor, or your patient. So make sure you pull back first. Okay, this just came out of the packet, so the end of it's sterile. I don't have to clean it all without. I would go ahead and take the cap off and just lay this in here. Okay. Put it somewhere where you can reach it easily. I'm right-handed, so I'm just on this side. Go ahead and get your dressing open.
Now, this would just
All right.
connect to the, and then the knee in the back of you, I can set it for 60 per hour.
Gonna block off the blood flow so this vein gets good and distended.
Okay. Now, say the doctor wanted to go at 100 cc's an hour, see that?
Alcohol will make the vein distend more. Also, don't look for a vein without the tourniquet on, because a lot of patients you're not going to find one at all. Once you think you found a vein, if you're not sure it's a vein, or if it's not just really apparent that that's a blood vessel, if you rub it really good with alcohol, it'll make it get bigger. Also, on your African American patients, it'll make it a little more shiny, so the elevation is a little bit more distinct. All right. On these catheters, this whole thing's not a needle, and it scares everybody. This is the needle, and only the tip of it's going in most cases, and then you can float the plastic part in. This has got a little catheter over the top of it that's plastic, and that's what stays in. Okay, you don't want to touch the needle. This button right here, once you get in the vein, you're going to push that button, and it sucks the needle back down into this chamber, and that's your safety mechanism. Okay, you're gonna hold right here with your thumb and your finger on these little indented areas, and then there's like a little, I don't know what you call it, like a little tab or something right there, and that's what you're gonna hold your pointer finger on, your index finger. The reason you're gonna hold it on is this slides on and off. Okay, you don't. If this slides forward, you don't want to pull it back onto the needle because it could catch the end of it and tear it off. And if it's in the patient's body, once you put it in the patient's body, it could break off and cause lots of problems, which we'll go over in lecture. Okay, so hold your finger down on it, and hold your thumb and your middle finger on the sides. Okay? Again, you're going to go in really shallow, and a lot of times you'll feel a pop when you get through the vein. Okay. Y'all see my flashback? Okay. Once you're in, you're not gonna, once you get a flashback, you're not gonna keep pushing at the same level, because if you keep pushing, or I'm sorry, the same angle, if you keep pushing, you're just gonna keep going down and go through it. So you're gonna lower it just a little bit, lower it and advance it, just to make sure you're in the vein, and then you can use your first finger and push it forward, or you can use your hand like this and start to push it, okay? I wouldn't get the needle all the way out until your IV's in, okay? I'm gonna push my button, and this is gonna start bleeding, okay, because it's in the vein. If you hold your thumb down over the vein, it'll slow it down some or even stop it, so you can get your cap and get it over here to the patient, okay? At this point, if you're not drawing blood from the IV, you don't need that pressure anymore. You can pop your tourniquet.
Some may have two,
And get this. Screw it up. If you're scared it's going to come on out, you can go ahead and tape it down. Okay? A lot of people tear their tape beforehand. I'll show you 2 ways to tape it. I usually tape it just down across like this. Okay? Miss Hill will show you to tape it a different way. And I'll show you that in just a second. Once you get it secured, go ahead and flush it, because if blood comes back in it and it stays there, it can clot off and then it's not any good. So go ahead and flush it. And before you disconnect the flush, you want to clamp it, because when you disconnect the flush, this little blue part springs back and it pulls more blood. Okay, so clamp it, then disconnect. Okay, then you can tape down with your regular dressing. Miss Hill likes to tape down, so she tells you like to butterfly or put your wing. Yeah, a lot of people will do this. To me, I would probably end up pulling it out if I try to do it. So I don't do it that often. I just tape across the top. She'll tell you. If you get blood on there, use alcohol to clean it up, or wipe it up before you put your dressing on there. You don't want a bloody, nasty dressing.
well, this is
Is it better for combative patients?
Not necessarily. I mean, all they gotta do is flip it up like that. But anyway, some people do that, some people tape down right here. Okay, when you do your dressing, yeah, it's fine to do it. When you do your dressing, okay, these have been tearing because they're old, but okay. If your patient is pretty aware and conscious and not super active, you can tape right here over the hub, and that'll come in handy when you're doing Mr. Lovren's check-off. If it's a patient that is confused and you're worried about pulling their IV out, you can tape it over the whole thing. Okay. Y'all's are a little bit different than us. Okay. Then there's a little piece right here, and you can do this before you put it on your patient, but write the date and time on it and your initials. And that way, people will know when it needs to be changed, because it usually gets changed about every 3 days. Okay, then you're gonna take this and tape it down. I usually tape this loop down so it doesn't catch on anything, and then tape up here some.
Volume to be intended. You remember that from the feet? Just like with your feet.
However you tape it, you want to make sure that you can see the end of this, because you want to be able to assess the entry site to see if they have any red lines going up, or if it's hard, or if it's hot, to see if they're having any complications with it. Okay. Any question about inserting?
It's pretty serious this time.
All right. When you DC an IV, you need gloves,
There's not 1,000 in there, there's 500.
cotton ball, and alcohol wipe.
And then a secondary would be like
It's coming out, so flushing's just to make sure it works. When you get ready to take tape off, especially on an older person, you want to make sure you have plenty of alcohol, and you can follow the tape underneath to try to separate it from their skin instead of just ripping it off. Okay, start with an area that's already open.
So can we not write directly?
Okay.
We won't be able to do that. Oh, that's, so.
Sorry.
Now let's do it again.
So if you have a saline lock and it doesn't have medicine on there, like specific
Oh,
code,
it's gonna have to be flushed every shift.
every shift, one flush every shift, the whole 10, or
Or
whatever.
according to what your policy or orders or, cause it's just. It's not, you're not ready.
Hold it down as you. I don't think you'll be able to use these dressings.
I have you to go. Over here. You know which one of them I did find it. Okay, and this is
I'm just gonna tear this across so y'all can see how to get it out, because the dressing's not coming. Alright, on this mannequin, to keep it from, or this skill, to keep it from bleeding out quite a bit, there's not a needle in there, that's just plastic. So you can put the cotton ball directly over it to keep it from bleeding everywhere. The main thing we want to watch when you take an IV out is that you check the tip to make sure it's intact. Like I said earlier, pieces could break off and get into the patient's system. So one of the things you're going to chart is if the IV tip or the catheter tip was intact. If it's not, I believe your book says tie a tourniquet on your arm and call the doctor
But
immediately.
how do you know how long it's been gone?
No, you don't.
the pharmacy.
So what's the point in turning it?